Back, part two of COVID-19 economics, and we are now going to talk about the first benefit cost study of COVID that we did here at UW back in March. This is the team: Professor Tunstrom, Newbold, Finoff, Madison Ashworth as a graduate student, and myself. You can download the paper right there at that link if you're interested in all the gory details. And so what we want to understand here is how to think through the process, how to think like an economist again. And we're thinking about the benefits and the costs of using social distancing to flatten the curve for COVID-19. Right? And so part of this started when Dr. Tunstrom and I were having coffee. She's my wife. And she asked me, are we overreacting? And I said, I don't know. And for who knows, luck would have it, Amy Harmon from the New York Times called me later that afternoon and said, I heard you guys think about risk and you're thinking about COVID. And so this got us started on this study in which we're asking this taboo question about, are we overreacting to this COVID virus and by trying to shut down the economy? Okay, so the real question is, are the attempts to slow the rate of COVID by social distancing worth it? Is it worth the cost? And we want to estimate the net benefits to social distancing based on what we knew in March. All right. And what we knew in March was not a lot, not what we know today. I mean, it was pretty sketchy because information was coming in as best we could. We had information from the 1918 pandemic that we could use, but we were in many ways trying to collect the best information we could to estimate these costs and benefits. So if we think about it this way, we got benefits and costs. The benefits are lives saved. The costs are loss of GDP. It's not quite, it's a little apples and oranges in some ways because lives saved. What are you talking about? How do we put a dollar value on lives saved? We'll talk about that in a minute. Versus comparing it to a loss in GDP, which is just consumption, price times quantity. So this is a what I would call an economist's bold leap into the unknown to say, no, we are going to compare these things and we're going to put dollar values both on lives saved and on lost GDP, and we're going to see whether or not the policy of social distancing is worth it. Right? Dollars and human lives translated into dollars, where one life is worth $10 million. And you say, value of life? What? $10 million? What is that? Well, let me just give you a short description of it. So the value of life is really the value of statistical life. So it's not anyone's life in general. It's an abstract concept that says, all right, what we're really interested in is the aggregate demand for reductions in widespread but very small risks of death. Okay, so the chance of you getting COVID is a relatively low probability event, but it has a high severity. You could die. And so we're trying to understand how people react to these low probability, high severity events in general, because there are terrorism risks, there's environmental risks, there's food safety risks, there's driving risks, everything's a risk. And we make trade-offs every day, right? If there was not if we put the value of life at infinity, then our speed limits between here and Rollins would be 2 miles an hour, right? Because no one would ever die at 2 miles an hour. They might die of boredom, but they're not going to die of an automobile accident if everyone is forced to go 2 miles an hour. Well, okay, that says we don't do that. People speed, people go slow. Trucks drive in snowstorms they shouldn't. People make these trade-offs all the time between risk and reward, and some of them involve dying. And so economists have spent a lot of time and a lot of intellectual energy trying to link up these either wage risk trade-offs or time risk trade-offs, things that, you know, we talk about in terms of trying to understand what's happening here in terms of I'm willing to pay so much money to get to Rollins quicker, but it increased my risk by 10% of being in an accident. We make those kind of trade-offs all the time, and economists try to measure the value of those. It's not like economists are making up the number. I think of it more like a thermometer. The number already exists in your head, in everybody's heads, and economists are trying to like use a thermometer or the best way to think of it is a thermometer to measure what that value is. In the U.S., we use $10 million per life at the federal government level. That's what the Environmental Protection Agency uses, the Department of Transportation, anything that has a policy change that implies value of life. And here's a paper link that you can read more up on this if you're interested in it. All right, so what we did is we used an epidemiological model of disease spread to calculate the number of deaths due to COVID with social distancing, the number of deaths without social distancing, and then we compared the two to figure out the number of lives saved due to social distancing, right? This is the benefit side. So you can see what this graph over here shows, the number of days and the number of infected, and you can see the dotted line, the horizontal dotted line right in the middle there, that represents the capacity of hospitals to be able to handle infected people. So the tall, narrow spiked line represents the no social distancing scenario. So it would hit that threshold of hospitals being able to care for you, which would mean more people dying. The idea of flattening the curve is to have social distancing, which would then push this curve down so that the number of infected would go down, so it would not hit that boundary that is set by hospital capacity. So that's the whole idea behind the policy, is essentially flatten that dotted distribution into that solid line distribution to the right of it. That's the whole idea of it, right? So social distancing flattened the curve, and social distancing, by our estimate, given all the data that exists, would save 1.2 million lives times 10 million. Okay, and that matches up with what the White House had at the time, right? The black distribution was no intervention. The flattened curve was with social distancing. Okay, so if social distancing saved 1.2 million lives, then benefits from social distancing are $12.4 trillion. If you know, there's obviously some numbers behind the 1.2 million that it expands out. Okay, so we got one side of the equation, the benefit side. The cost side, well, now we got to look at the loss of GDP. And here we're going to use the present value of losses of GDP with and without social distancing from Goldman Sachs and from another set of economists, McKibben and Fernando. And we are going to look at losses calculated with 1.75 growth. Remember our rule of 72? To look at, you know, the faster the growth rate, the faster well-being increases. Well, here is 1.75, which is approximately what we had been witnessing in the quarters beforehand. All right, so if we compare those two present values, with and without social distancing, we're thinking about some scenarios here, ignoring the equations on the left. You can see If there was no outbreak, that is the top dotted line in terms of years and GDP. If there is an uncontrolled outbreak, what happens is there's going to be a drop in GDP and then it's going to rise. And if there's a controlled outbreak in terms of social distancing, there's going to be a steeper drop and it will also rise. And then eventually, at some point out in the future, it's going to come back to the baseline, the no outbreak baseline eventually. And so the question is, what does that translate to? Present value is 13 trillion with social distancing. So it's more expensive than right. So the cost would be 7.2 trillion. There should be a without social distancing there. That should have been 6.5. So the cost of social distancing is 13.7 minus 6.5 or 7.2 trillion. So I need to fix that typo there. So the second dot, the present value of loss of GDP without, without social distancing. So now we have our benefits and we have our costs, and clearly the benefits outweigh the costs in this case. It's a rapid analysis suggesting that social distancing policies are worth it. The net benefits were 5.2 trillion based on our estimate. And that was the only number that existed during the time. This is what the government economists are supposed to do at the Council of Economic Advisors, is do exactly what we did. Here in Wyoming, we're the first ones. We, guys at Harvard, the guys at Chicago, guys at Stanford, all the other big universities were following us because we were willing to try to put these numbers together. Now, we're saying that the social distancing was worth it. Now, that costs and benefits might tip the other way if you want to put a lower value of on statistical life, right? If you cut that 10 million down to 5 million for statistical life, that would cut that 12.4 trillion in half. And now the costs are not worth it, right? So now social distancing wasn't worth it because what we assigned to the value of statistical life. Or if you think the costs of social distancing were much higher because of things that we didn't account for, right? We didn't account for more time with family, less education, mental health issues, suicide, addiction, domestic violence. All those costs of social distancing we don't include, right? And, that's part of your job as an economist, is to try to get at as many of the costs and benefits as you possibly can. We didn't know what are the costs and benefits of isolation in terms of social issues, in terms of mental health issues, in terms of more addiction, more suicide, more domestic abuse. I mean, those things are real and they are costs, but we did not include them in this study. How big would they have to be for that to have tipped the scale the other way? Fair question, right? So benefit costs, it's just another tool to think about the idea of value created or destroyed by trade. Another way to think about benefits costs is to break them down into increments, what we call marginal benefits and marginal costs. Assessing how we make these decisions unit by unit, all right? Thinking at the margin is the term, and that's where we'll pick up on part 3 of this lecture.